Hi everyone, my name is Jillian McLaughlin and I am the Director of Operations for Lyndon Rescue. I'm going to be talking about a career in Emergency Medical Services, or EMS. I've been working at Lyndon Rescue for 13 years. There are 4 levels of EMS provider that you can become certified at. The first one is Emergency Medical Responder, or EMR. This is geared towards people who live in communities where they would be able to respond before the ambulance arrives and provide some of that initial care to someone. The class is about 60 hours long, and they learn how to do CPR, how to control bleeding, and treat other injuries. They also learn how to take vital signs so they can get someone's blood pressure and their pulse, listen to lung sounds before the ambulance arrives, and give them an update. The second level of EMS provider is EMT, or Emergency Medical Technician. They can give some medication, so they might be able to give aspirin or nitroglycerin to someone having chest pain. They can give epinephrine to someone who's having a severe allergic reaction. And they can do all the skills that an emergency medical responder can also do. The third level is advanced EMT. You have to be an EMT before you can take the advanced EMT class, or AEMT. The AEMT class is 150 hours, and they learn more advanced skills such as how to start an IV and give medications through that IV. So an AEMT might give a medication for nausea through the IV or give epinephrine to someone in cardiac arrest. The fourth level and the highest level of pre-hospital emergency medical services is Paramedic. That is a 2-year program, and some programs you can get an associate's degree at the end. There are some more advanced airway management techniques that a paramedic may do, so they can do endotracheal intubation, where they put a tube down someone's throat to go into their airway and secure it better to make sure that the air is going down into their lungs and not into their stomach. And they can also give more medications than the AEMT. So they might give a medication to someone who has an abnormal heart rhythm, or they can also give pain medication to someone who has a traumatic injury. There is also an option to go into management or be a supervisor. So I get to do both, where I can work in my office on the day-to-day operations of the company, but then I can also go out on 911 calls if needed. There are many different career paths for someone in EMS. Some EMTs work at theme parks or on a cruise ship, and others work in 911 systems where they respond to 911 calls. There's also EMS providers that work for non-emergent EMS agencies, so they might bring someone from their house to a dialysis appointment and then back to their house for someone that isn't able to get in a car, or they might bring someone from the hospital back to their house or a nursing or rehab facility. There are also community outreach events that EMS providers can do, so they might go to a safety fair or a wellness fair. We have some people that teach CPR and first aid classes, a few that install child safety seats. So there's many different things in addition to going on 911 calls and responding to emergencies that you can do as an EMS provider. At Lyndon Rescue, we have 6 full-time EMS providers that work either 36 or 48 hours a week. So they work 12 or 24-hour shifts, which means that someone might work Monday for 24 hours, so they'd start at 8 in the morning and end at 8 in the morning on Tuesday. And then they could come back Wednesday and do the same thing, which would then give them Thursday through Sunday off. So that's one of the benefits, is that you could work 2 days a week, even though you're working that whole 24 hours, then you can have that 4 days off. They might come in if there's multiple 911 calls at once, or someone needs to be transferred from one hospital to another. But their normal scheduled shift might be 2 24-hour shifts, or 1 24-hour shift and 1 12-hour shift throughout the week. We also have part-time employees that may have a different full-time job during the day, but they come in on night or weekend and work a 12-hour shift, or just come in for second calls if there's more than one 911 call at once, or if someone needs to go from the hospital back to a rehab facility or from hospital to hospital. While they're not responding to 911 calls, there's lots of different tasks for EMS providers to be doing around the station. So they, at the beginning of their shift, have to check the truck, make sure that they have all the equipment that they need and it's working the right way so that they're prepared for when they go on a call. When they get a call, they need to make sure they drive there safely, find the right location, and then they determine what's happening and what care they can provide. If someone needs to be transported to the hospital, one person will stay in the back of the ambulance and continue to provide care, and the other one will drive safely to the hospital. Once they get there, they'll need to restock all of their equipment after the call, make sure it's clean up any blood or other substances that may have gotten on the ambulance, dirt, and then afterwards we always write a report, so there's always a record of what care someone was provided on the call. All levels of EMS provider have to recertify every 2 years, so we also do trainings. We need to make sure that after we've done our initial training, we keep up those skills, learn new skills, so we do trainings at least once a month and some online trainings as well. All the levels need to do hours every 2 years, so we can get those by training like a lecture, but we could also do practice calls, mock drills, and online trainings as well. Someone who's looking into this career needs to have good communication skills. You need to be able to deal well with stressful situations and have good decision making. There's a lot of stress that can come with this job and responding to medical emergencies or traumatic injuries. So staying calm and trying to figure out what's going on and then deciding what's best to do for that person is necessary to be a good EMS provider. You also need to communicate with a variety of different people. As an EMS provider, we get dispatched by a dispatcher who takes the 911 call and gives us the information that they've gathered. Then we need to be able to communicate with the person that needs our help and any family or friends that are there. And then we communicate with the hospital to tell them what's going on and what we've done for that person. There's also some basic math involved. We might need to calculate a medication dosage or how much IV fluids to give someone. So the math might include taking someone's weight that they tell us in pounds, converting to kilograms, and then calculating how much medication we would give someone. If you were looking for a class in high school to take that might help you prepare for a career in EMS, anatomy and physiology would be a great idea. Learning how the body works and how everything runs normally will help you as an EMS provider to be better able to do a good assessment, ask questions about the injury or the illness, and figure out how to help the person. One of the skills that we practice often is CPR, or Cardiopulmonary Resuscitation. If someone stops breathing and their heart stops beating, CPR keeps blood and oxygen going to the brain and vital organs until their heart starts beating again on its own. Basic CPR is made up of 2 skills: chest compressions, where you push on the chest, and giving breaths. If you haven't been trained in CPR, then you can just do the chest compressions. Push hard and fast on the center of their chest. The 911 dispatcher can walk you through all the steps to make sure you're going at the right rate and give you instructions if you're not sure what to do. If there is an AED or automated external defibrillator available, then you can use that as well. They are simple to operate with just a few steps. Turn it on, put the pads on, and follow the commands. Usually this just includes pushing one button if it's going to give a shock. As EMS providers, we use more advanced equipment and skills. We have mechanical devices that can do chest compressions for us. It prevents us from becoming tired from doing chest compressions. When someone gets tired, their chest compressions don't go as deep, so they're not as effective. So the mechanical device will always give the right depth of compressions. It's also safer to use if we're doing CPR in the back of the ambulance while it's moving, rather than having someone stand up in the back of the moving ambulance to try to do compressions. We also have different methods to give breaths rather than mouth-to-mouth breaths, such as using the bag mask device you see in the video. There's also more advanced devices called advanced airways, where a tube goes down the person's throat and into their airway to give the breath through. These devices help ensure that the air we're pushing in with the bag valve mask is going into their lungs and not down into their stomach. If you think you might be interested in a career in EMS, you could start by taking a CPR or first aid course. There are many online or in-person classes available. Many EMS agencies have programs where someone who thinks they might be interested in a career in EMS can ride with the crew on the ambulance. This is a great option to make sure it's right for you before committing to taking an EMT class.